Assalamu alaikum, I am Dr. Iram. Today we are going to discuss about the brachial plexus. As in the previous video we discussed, the plexus is the network of nerves. There are 4 plexuses in our body: brachial, cervical, lumbar and sacral. Brachial plexus is formed by the combination of anterior rami of C5, 6, 7, 8 and T1 nerve roots. C5 and 6 combine to form the upper trunk. C7 continue as the middle trunk. C8 and T1 combine to form the lower trunk. Then these trunks divide into divisions, anterior and posterior divisions. These divisions then combine to form the cords: lateral, posterior and medial. Lateral cord formed by the combination of divisions from upper and middle trunk, anterior divisions. Posterior cord formed by the combination of posterior divisions of all these 3 trunks. And medial cord is the continuation of the anterior division of lower trunk. Then these divided into branches: lateral cord into 3 branches: musculocutaneous, lateral branch of pectoral nerve and lateral branch of median nerve. Posterior cord divided into 5 branches: upper subscapular nerve, lower subscapular nerve, thoracodorsal nerve, axillary and radial. Medial cord divided into 5 branches: medial cutaneous branch of arm, medial cutaneous branch of forearm, ulnar, medial branch of pectoral nerve and medial branch of median nerve. If the injury to the posterior cord takes place, then the radial palsy results. C5 give another branch, that is the dorsal scapular nerve. It supplies 3 muscles: levator scapulae, rhomboid major and rhomboid minor. Another branch originates from C5, 6 and 7 is the long thoracic nerve that supply the serratus anterior muscle, and injury to this nerve cause the winging of scapula or Horner syndrome. Cords are in relation to the axillary artery, as the lateral cord is lateral to axillary artery, posterior cord is posterior to axillary artery and medial cord is medial to axillary artery. We can remember this through our mnemonics. Remember to drink cold beer. Roots then combine to form the trunks. Then these divide into anterior posterior divisions, but no nerve arises from the divisions. Then these combine to form the cords, and these divided into the branches. We can remember this by a tree, as the tree has roots C5, 6, 7, 8 and T1. Tree has a trunk and lateral, upper, medial, posterior and lower. Trunk divided into anterior and posterior divisions. These combine to the cords: medial, lateral and posterior, and these divided into branches. So this is the brachial plexus. In the next video we will discuss that how the nerve damage take place and how we can treat them and how to diagnose them. Thank you.